So we are going to tackle the acquired or adaptive immunity. And this is acquired by an individual during life by recognizing and selectively eliminating specific foreign molecules. So it provides a second line of defense against infection. So the first one that we talked about, the innate immunity, provides the first line of defense. You do not have any other immunity apart from that. Before this one develops, you have to be exposed to certain pathogens over time. So the more you expose, the more you develop this immunity. Yeah. So it's a second line of defense. And then, what are characteristics of this type of immunity? The acquired immunity. So it is antigen specific. What do you mean by that? So this immune system or antibodies can distinguish among antigens, even between two proteins that differ in only one amino acid. It is so specific. These antibodies and antigens, they have binding sites. Even if the only difference is, if you've seen amino acids, you can tell how they can resemble each other. Even if they differ by one amino acid, it can differentiate. It will never be working against something else, no matter how much it resembles that particular antigen. You understand? So it is antigen specific. And then we have the second point, which is diversity. The second characteristic of this immunity, which is diverse. So immune system is capable of generating large antibody diversity in its recognition molecules. So you can have so many antibodies in your body, each antibody against a particular antigen. So you understand? So it is limitless. You can have as many antibodies which are specific to different antibodies. I read somewhere, I came across somewhere that it was 10 to power 15. You can have as many antigens, as many antibodies as 10 to power 15 or more, which are different. So anytime you develop a pathogen, your body fights it, an antibody. Anytime you encounter another pathogen or antigen, another antibody is formed. You understand? You can have, they are limitless, so many. So the next characteristic of this immunity is it is immunologic memory. Immune system exhibits memory on second encounter of the same antigen by generating a secondary response which is more specific and quick. You understand? So yeah, as I told you, the reason why you are having antibodies against that particular antigen that has come to you again is because you have immunologic memory. Your body will keep memory of what had attacked it. You understand? So that is immunologic memory. And then the third characteristic of this acquired immunity is that it is non-self recognition. What do you mean by that? It does not react with body's own molecule, but effectively eliminates foreign antigens. It is not supposed to fight, it is not supposed to fight your own cells. It is able to realize what is foreign. But we have some diseases where your own immune system attacks your body, attacks itself. But now in this, on an ideal situation, it is not supposed to attack you. It is supposed to attack antigens. It does not react with body's own molecule, but effectively eliminates foreign antigens. So it knows you, it knows your body, it knows your cells. You understand? All right. So let's go on to the types of acquired immunity. We have two types. We have active acquired immunity, and then we have passive acquired immunity. And when we talk about active acquired immunity, what are we talking about? We have natural active immunity, and then we have artificial active immunity. And then when we go to passive, we have natural passive immunity, and then we have artificial passive immunity. So we have natural and we have active and passive, and in both we have natural and artificial. Let's see what we mean. What do we mean? So we are talking about the acquired immunity, and we have seen we have active and passive. And when we come to active immunity, which is also called adaptive immunity, it is developed by an individual. This is resistance developed by an individual as a result of an antigenic stimulus. So an antigen has been introduced into your body, and you will develop this type of active immunity. And it is used for prophylaxis, to increase body's resistance, or preventive measures. So two types of active immunity. We have natural active immunity, and we have artificial active immunity. We'll come back to that. Let's go to passive immunity. So that is the second branch of acquired immunity. And with passive immunity, resistance is transmitted passively to a recipient in a ready-made form. For instance, this means recipient's immune system plays no active role. So you are just given an antibody, basically. An antibody is introduced into your system. Unlike in the active one, where your body is made to produce the antibody by itself. You understand, yeah? So it is used for treatment of acute infection, and then we have two types. So this one is used for treatment of acute infections, and the other one, active immunity. The work of the active immunity is to give the body its own protection, to arm it. It's like to give it arms of action, fireworks. Passive immunity, it is to treat acute infection. Yeah, we have two types of passive immunity. We also have natural passive and artificial passive. All right, let's look at the differences between these two. Maybe we can understand better, yeah, between active immunity and passive immunity. Yeah, so let's look at their major differences. So with active immunity, this is produced actively by the host's immune system. So an antigen has been introduced into your system, and then your body produces this immunity by itself. All right, but with passive immunity, it is received passively. You just receive the antibodies, no active participation of the host's immune system. Your immune system is not producing anything. It is just receiving and fighting that particular infection. Yeah. The second point of the differences is it is induced by infection or by immunogens. This is when we have a killed form of an infection. Endotoxins can be introduced to your body. A weakened form of an organism, of a microorganism, can be introduced into your body so that your body can try to fight it. Yeah. But the other one is conferred by administration of ready-made antibodies. That one we have said it so many times. Yeah. And then the second one, the third point, is that active immunity is long-lasting and effective protection. So the moment you develop an active immunity, it is there to stay. All right, the way I was telling you earlier on, that you have so many antibodies in your bodies, 10 to the power 15 or more. Yeah, but with passive immunity, it is short-term and less effective protection. So its work is just to fight what is there, and it is not going to be stored in your body. It is, when it finishes its job, that's it. And then we have the fourth point. Is it the fourth or the third? Yeah, the fourth point. Active immunity is effective only after a lag period required for generation of antibodies. So this will be effective after some time. So we have introduced an antigen into your body. Your body will have to take its time to produce the antibodies. It is not going to work instantly. Okay, but with passive immunity, it is immediate immunity. You have ready-made antibodies, so in your bodies, and they start working. All right. So the fifth difference, immunological memory is present. So your body is going to remember that it produced these antibodies and it has them. So the moment that an antigen gets into your body, is going to be, the antibodies are there. It's going to remember this particular antigen that had attacked you. But with passive immunity, there's no memory. They finish their job, the antibodies finish their job, and off they go. Now memory cells are there. Next point is negative phase may occur. Negative phase we mean period of being sickly, because obviously this is a pathogen that has been introduced into your body. So that reaction of your body to a pathogen, that is a negative phase. But the other one, we don't have pathogens that have been introduced apart from the ones that you have. So we don't have a negative phase. Okay? And then the last point, it is not applicable in immunodeficient. Immunodeficiency, we say people who have low immunity, there is no point of giving them this type of immunity, because with this type of immunity, we want your body to produce the immune cells by itself, to produce the antibodies by itself. But with an immunodeficiency person, it's not going to happen because it is compromised already. Yeah? But with passive immunity, it is applicable in immunodeficient. You're just giving them ready-made weapons, so it's fine. Yeah. So those are the differences, and I hope it is very clear. Yeah. So let's look at types of acquired immunity. We just mentioned we have active, we have natural active and artificial active immunity. What did we mean by that? So natural active immunity results from either a clinical or an inapparent infection by a microbe. So if you are infected by a pathogen, if you caught, let's say you caught smallpox, let's say you just went and contacted a new disease in your body, it's going to affect you. But the good part of it, if you recover, if it doesn't kill you, you're going to end up having those antibodies against that disease. Yeah. So that is what we mean by that point. It is usually long lasting. And the moment you have those antibodies, you have them. They are not going anywhere. They're going to stay. And the next point, it is usually long lasting. For example, person recovering from smallpox and measles develop natural active immunity. So if you recover, you develop that immunity. Something to note, we have premonition is a special type of immunity seen in syphilis. So when you recover from a disease, you're going to have immunity against that disease. But there's something interesting about syphilis. So we call that immunity, what do we call it? We call it premonition, a special type of immunity seen in syphilis. So immunity to reinfection lasts only as long as the original infection remains active. So once the disease is cured, the patient becomes susceptible to the spirochetes again. So the moment you have been cured of syphilis, the antibodies against syphilis off the window. So you have to develop another immunity after another. You have to develop other antibodies against syphilis after reinfection. So an exception there. All right, but most antibodies are there for life. You also have to understand something about mutation and some immunities that do not last for long. Some diseases such as measles are likely to give you a lifetime antibodies, but there are others that they will disappear over time. Yeah, and in cases of artificial immunity, you will look for it. Yeah, we will see about artificial active immunity. You will need booster vaccines, because antibodies will go and disappear due to mutations and all those kind of things. So in as much as we are saying they are lifelong, some of them are not, like you've seen in the cases of syphilis. Yeah, you need to be reinfected again to have the antibodies. All right, so let's go to, we have finished about natural active immunity. Now we are going to passive active immunity, and we will see what that is. So artificial active immunity resistance is induced by vaccination. You all know about vaccinations, where you go and you are injected. Let's see what you're injected with. What are vaccines? We defined a vaccine in the definition video. So vaccines are preparations of live or killed microorganisms and their products. These are preparations biologically prepared of microorganisms. These microorganisms can be dead or live. Yeah, and their products, antigens. And so what do these microorganisms have? They have antigens and toxoids. All right, so we have bacterial vaccines, we have viral vaccines. So we have bacterial vaccines and viral vaccines. All right, what is there in the bacterial vaccines? We have live or attenuated. So we have live, those are live bacteria, weakened form of bacteria. For example, in the BCG for tuberculosis, that is a live or a weakened form of tuberculosis bacteria. We have killed bacteria. For example, in case of cholera vaccine, so the bacteria is killed. And then we have subunit bacteria. An example is typhoid VI antigen. All right, so subunit, what do we mean by subunit? So by subunit, we mean a specific part of the bacteria. For example, we can have the protein or sugar rather than using the whole pathogen. That is what we mean by subunit here. Then we have bacterial products. For example, toxoids. Toxoids are produced by the bacteria. So we can have bacterial vaccines produced from all those things. Live or attenuated bacteria, we can have a killed bacteria, we can have a subunit, which we said is a part of the bacteria, and then we can have a bacterial vaccine from the bacterial products such as toxoids, capsules, all those products that bacteria produce, yeah? And then we have viral vaccines. So don't forget, we are talking about artificial active immunity, yeah? We have viral vaccines. They are also produced the same way. We have live or attenuated viral vaccines. For example, oral polio vaccine called Sabin. We also have killed viral vaccine. For example, injectable polio vaccine, Salk. We also have subunit viral vaccine. For example, hepatitis B vaccine, right? So I hope we are very clear on active immunity. We have talked about natural active immunity, and then we have talked about artificial active immunity. And in natural active immunity, that one you have to be infected naturally by a pathogen, and then you will develop antibodies against it. And then artificial active immunity, you have to be, something has to be put into your body so that your body can react by forming its own immunity. So it has been induced artificially, but in the other one, it just came to you. All right? Okay, so let's look at the types of passive immunity. So we're going to look at passive immunity. Actually, I've realized I haven't told you the difference between active immunity and passive immunity. Yeah. So active immunity is the resistance to pathogens or to antigens that you develop when you have been exposed to the pathogens. So active immunity is the immunity that develops in response to exposure to a pathogen or through vaccination when the body encounters a specific pathogen, such as a virus or bacterium. All right? You develop that immunity after you've been exposed to. So you develop your own antibodies. That is what we're talking about, active, yeah? And then we have passive, the one that we are going to cover right now. So passive immunity is a temporary form of immunity, and this occurs when antibodies are transferred from one individual to another. This transfer can happen naturally, such as from a mother to her baby during pregnancy or breastfeeding, or artificially through administration of antibodies derived from another individual or animal. Passive immunity. So passive immunity provides immediate protection but does not result in long-term immunity because the recipient's immune system is not stimulated to produce its own antibodies. With passive immunity, your body is not doing the work. So something has just been put into you. You understand? And that's why we have natural passive immunity and we have artificial natural immunity. Artificial passive immunity is what we talked about there, where antibodies are just injected into you, all right, or are just given directly to you. So we have types of passive immunity. We have natural passive immunity, and natural passive immunity is resistance that is passively transferred from mother to fetus or infant through placenta. We call that transplacentally, and through milk, which is colostrum. When the baby is breastfeeding, they are likely to get this natural passive immunity. So nothing has been injected into them; they're just getting them naturally, yeah. And when they're in the womb, so these antibodies are likely to cross over, and that's why we have something like the rhesus factor, which can affect the fetus negatively, all right, because the antibodies are crossing over to the baby. You understand, yeah? And that's why the breastfeeding mothers, you're told, oh, you can breastfeed your child because these antibodies will pass to the baby through breastfeeding, okay? And you have something we call artificial passive immunity. So that one we have already touched in. So this is the type of immunity where resistance passively transferred to a recipient by administration of antibodies. Agents used are hyperimmune sera of animal. We have convalescent sera. We have pooled human gamma globule. So these are used for prophylaxis and therapy. And then we have something called combined immunization, combination of active and passive method of immunization. Remember, we have talked about active artificial, and we have talked about, passive artificial, yeah? So we can have combined immunizations whereby you have been given a vaccine that is supposed to make you produce antibodies. Remember, this one takes time, but again, you can be given two of them, whereby you've been given these that will produce antibodies later. They can be combined. You'll be given a passive artificial as well, because this one acts immediately and this other one will act later. Yeah. So why are we doing that? Combination of active and passive method of immunization. So whenever passive immunization is employed for immediate protection, combined immunization is preferred. So they will prefer giving you following it up with the one that will work immediately. For example, protection of non-immune individual with a tetanus prone wound, that is injection of TIG from one arm, and the first dose of tetanus toxoid in other arm, followed by full course of phased tetanus toxoid injection. So you'll be given a tetanus antibodies, and then it will be followed by a tetanus toxoid that will make you produce your antibodies against the tetanus. Yeah. So TIG provided the protection necessary till active immunity. So the TIG will provide the protection necessary until active immunity is able to take effect. You understand? That's why we have combined immunization. So the moment you hear that we have combined immunization, just know we are talking about active artificial and followed by passive artificial given together. All right. So I hope we are getting these things. So we also have something called local immunity. And what is this? This is a natural infection or live vaccine administered orally or intranasally to provide local immunity at site of entry, such as the gut, mucosa, nasal mucosa. So here you can see we are just talking about epithelial surfaces. For example, in the oral. So this one provides a local immunity, local type of immunity, and it, IgA plays important role in local immunity. If you haven't seen what IgA is, go to the definition video, or at the beginning of this video we have definition of terms. So IgA plays an important role in local immunity. So this is the type of immunity that is usually present in the mucosal cells. All right. Then we have something called herd immunity. Herd immunity is overall level of immunity in a community. By herd immunity, we mean most people are vaccinated against a certain pathogen, or they have been pre-exposed before, so they are immune to that particular pathogen. Overall level of immunity in a community is relevant. It is relevant in control of epidemic diseases. So epidemic diseases are diseases that spread rapidly and affect a large number of people. Okay. Within a particular, and affect a large number of people within a particular population during a relatively short period. These diseases can be caused by various factors such as infectious agents like bacteria, we have viruses, or parasites, and we can also have environmental or social factors. And the examples of epidemics are, we have influenza, cholera, Ebola, COVID-19. So if a large group of the community is vaccinated against these diseases, then we have herd immunity. Our population is vaccinated against it, they have good resistance against it. Yeah. So eradication of communicable diseases depends on the development of high level of herd immunity rather than development of high level of immunity in individuals. Okay, so if you want to eradicate diseases like communicable diseases, you don't need individual immunity, because if this person is immune and 10 others around them are not immune, it's like just doing zero work, because it will just be rotating. So it requires herd immunity. So a lot of people to be vaccinated or to be immune to that communicable diseases, something like tuberculosis. We all know that children are given this TB vaccine in very early ages. Yeah. So that's it, guys, about immunity. I hope we have covered as much as we can, and by this time you are well equipped with immunity. All right. So see you in the next topic. I hope you are learning, and let's meet in the next video. Bye.